Suffering from physical pain you can't seem to shake? Well, the Dream Team at CORA Physical Therapy helps you pinpoint your problem and treat it with expert care. This next Ask the Medical Expert has been sponsored by CORA Physical Therapy. With 8 different area locations in St. Louis, they will treat you with everything they know to restore your quality of life.
CORA Physical Therapy is an outpatient PT provider for everyone. We serve the communities that we're in, whether that's a pre or a post-operative condition or orthopedics, or you get hurt at work, or you get hurt on the field, or you get hurt at the gym, or your mother has back pain. So we see any and all types.
A host of solutions for a myriad of ailments. The staff at CORA Physical Therapy is trained to recommend the best option for you, like dry needling.
Dry needling is a technique that we use in physical therapy that what we'll do is we'll use a really tiny needle. I know it can be intimidating using a needle, and we're gonna find that tightness in a muscle. And so we'll find that trigger point, we're gonna put the needle into the trigger point. It's gonna create a healing response that'll increase the blood circulation and reset that muscle.
It's a non-invasive technique that provides instant relief.
It's immediately going to improve their function. I had a patient just come in today that could only raise his arm to here. I did dry needling to his lat and he had full elevation. So immediate results in function, decrease in pain, and just releasing those tight spots in the muscle or trigger points.
The perfect treatment for a variety of pain.
Dry needling is going to help head to toe, from headaches to neck pain, to shoulder arthritis, tennis elbow, down to arthritis in the wrist, pain in the knee, plantar fasciitis. We can treat the entire body with dry needling.
Powerful therapeutic treatment geared towards giving patients a wider range of motion.
With the dry needling, we like to use electrical stimulation, and so we're actually stimulating directly into the muscle. So we needle, you get that involuntary twitch in the muscle, and maybe you don't get the full twitch response that you want. You follow that with electrical stimulation. It helps to improve the function of the muscle even more.
A small needle, a slight shock, an immediate path to release.
Patients don't think it hurts at all. It feels just like a tiny pinch. So I would say it's not uncomfortable at all. They're willing to withstand that needle because they see the extreme benefits of it.
It's giving me part of my shoulder back. Former NFL player, had 3 really bad shoulder operations. No more usable tissue left in my shoulder. I got to a point to where I could barely lift it. I've had some of the better people in the world work on me before, and when I talked to Doc and he told me to come check out Ashley at CORA, and then I got to know some of the other therapists at CORA as well, made me feel more comfortable. Gave me a place that I felt like, at least here, being back home, I have a place to go to rehab now.
Cost-effective and conservative treatment can be achieved seamlessly through CORA Physical Therapy, so your healing can start right now.
We serve the communities they're in because we take all the insurances that we're in. And if we don't have that, we're gonna work out a deal with you so that you can get the care that you need.
Okay, so if you have any questions at all about dry needling, just come into the clinic, call any of our 7 locations that are found on our website, and we'll make an appointment. We'll sit down with you, and we'll see exactly what's going on and see if you would be a good candidate for it. And then from there, we can contact your doctor's office and get the prescription for you. So you can begin and there's no lapse in care, and we can get you better as quick as possible.
A spectrum of services focus on an outcome that can heal you.
We are a base of conservative care. So we're the first line of defense against pain. So we try to help people get off of any sort of drug that they might be taking, like opioids, and we get them into stretching routines and strengthening routines to diminish the use of pain medication or anti-inflammatories. And so I think we also get involved in the pre-operative phases. So maybe someone is having back pain that they're going to need a surgery or have a surgery. We are usually the first line of defense that most physicians go to as a part of their treatment algorithm. It's conservative, it's cheap compared to other formats to help them get better. And more importantly, it gives them independence in choosing what they're going to do for themselves to get better.
Indepair, Chelsea Haynes, Studio STL.
Physical therapy.
Therapy has customized treatments for each individual patient to get back to participating in the activities that you love. You can book your appointment online at coraphysicaltherapy.com, and you can also find them on Facebook, Instagram, and on Twitter.